Hi everyone, how are you doing today, my good people? Welcome in today's live stream. So today guys, we are still on video reviews, and we are going to review our videos of our health videos. I know most of you or some of you have watched those videos, the health videos. So as you come in, let's engage, let's interact, let's communicate while we discuss those videos. Okay, so who is the first one to join today? Who is the first one to join us, guys? You're so much welcome. I'm waiting for you guys. I'm waiting. Who is the first one to join? Hey there. I'm waiting for you guys so we can start. I'm waiting so we can start. And if you've watched any of those health videos, you can also recommend, just like the other day. You can also recommend so that we can start with we can review that the ones you've watched. Okay. Who is here? Who is here, guys? Two people. Hello there. Who has joined? Who is here with me? Thank you so much for joining. Let me know who is there so we can start. Let me know. Come on, guys. Who is here? Who is here with me? Which one should we start with, guys? No one is here yet. Oh my god. Oh my god. Uh, no one is here yet. You people, where are you? Where are you? Where are you, my good people? Waiting. Or should it die? Just start, you guys. You will get me. You will find me. Me when you come. Hey Rico. Rico is here. Nice to see you, Rico. How are you? Thank you so much for coming around. Thank you so much. How are you doing today? How is your weekend? How is your weekend going, Rico? Good, and you? Mine is also going on well. Yeah, you guys, I wasn't able to live stream yesterday because of the weather. The Rift updates. Hello, how are you, my dear? Nice to see you, my good friend from Eldoret. Thank you so much for joining. You guys, I was not able to live stream yesterday because of the weather. It was so bad. Yeah, it was raining, and we didn't have electricity. It was so bad, so bad. Okay, you're so much welcome. Give me your likes. So today we are discussing, guys, on our we are reviewing our health videos here. Our health videos. Anyone you've any that you've watched, which one have you watched that you can start with, guys? Thank you so much for the likes, guys. Yesterday's weather was just poor all over. LD wasn't better in any way. Oh, you see, too bad, too bad. And you know, it's just everywhere, by the way. All the counties, almost all the counties, it was raining. Yeah, even in Western, it was raining. And it started so early, too bad. Anyway, should we start, guys, with our discussion today? What are we doing today? Today we are reviewing our health videos, health educative videos that are on this channel. Like, there is a video that I had planned to start with. There is a video that has a title, "What Syphilis Does to the Body. Should you test?" Yeah, that is the video that I want us to start with. Have you watched the video, Rico? Which one have you watched? There is others in a playlist of inside her body. Have you watched any of those? Who has watched any of those? If not, let's discuss, and then you guys will go and watch later. Okay, I forgot to watch. Okay, Rico, don't forget again today. Okay, don't forget today too. Make sure you watch them after today. Okay. So when you talk about syphilis, we're talking about a serious but treatable infection that spreads mainly through sexual contact. You guys know these sexual transmitted infections, right, Rico? It's a discussion. You can tell us what you know about that. Okay. Hi, Senka Miren. Welcome. Thank you so much for joining. Kindly like the live stream. How is your weekend going? What makes it dangerous? It was three people now too. They'll still come back, Rico. Don't worry. They'll still come back. Okay. What makes it dangerous is that it often starts quietly, and many people don't even realize they have it until it has already started affecting the body in deeper ways. Right? Rico, you know about these sexual transmitted infections. Syphilis. So we are talking about syphilis. Okay. So syphilis develops in stages, and each stage affects the body differently. In the early stage, a person might notice a painless sore, usually usually around the genitals, mouth, or rectum, because it doesn't hurt. People often ignore it or mistake it for something minor. They don't know when it starts to affect them. But even if that sore disappears on its own, the infection doesn't go away. It continues spreading inside the body. Okay. So that video explains everything about syphilis, how it attacks. Okay, Rico, how it attacks, how it infects you, affects you, all that. Okay. Yes, Rico, what's up? I want you to discuss this with me. What do you know about syphilis? As it progresses to the second stage, you know it attacks in stages. As it progresses to the second stage, symptoms can become more noticeable. Okay. People might develop skin rashes, especially on the palms of the hand or soles of the feet, along with fever, fatigue, swollen lymph nodes, or even hair loss. At this point, the infection is actively affecting the immune system, and it can easily be passed to others. Okay. So if you watch that video, guys, you'll get to understand better. I'm just reviewing it while explaining to you. Okay. So watching the video will teach you a lot. Is this about our body? Yes, Rico, about our body. It is about our bodies. Men too also gets attacked by sexual infection diseases. Okay. Yes, this can attack anyone, men, women, everyone. These are sexually transmitted infections. Okay. After that, syphilis enters what is called a latent stage. Okay, Rico, do you know syphilis? What is syphilis according to you? So this stage, latent stage, is where there are no visible symptoms at all. This is one of the most dangerous parts because someone may feel completely fine and think nothing is wrong. While the bacteria is still in the body, without treatment, it can stay hidden for years. Okay? It can stay hidden for years, by the way. Yeah, question. Do you know any sexual transmitted infections? You know syphilis is one of them. Which one do you know? In the late stage, which can happen years later, syphilis can seriously damage vital organs. It can affect the brain, leading to problems with memory, coordination, or behavior. It can also damage the heart, blood vessels, eyes, and nerves. In several cases, it can become life-threatening, by the way. This is why syphilis is not something to ignore. It's not just a small infection. It can have long-term consequences if untreated. Okay? So we see that it has to be treated earlier. Like you need to, when you just first see symptoms, you need to visit a gynecologist for treatment. Okay? Now the So guys, why should you test? Why should you test if you have syphilis, Rico? Okay. Why should you test? You know, testing is very important, especially if you're sexually active or unsure about your exposure. One of the biggest reasons is that syphilis can be present without obvious symptoms. So testing is often the only way to know, okay, if you have it or not. Testing is usually simple, often just a blood test, and it's widely available in clinics and hospitals. The If syphilis is detected early, it can be treated effectively without antibiotics. Early treatment can completely stop the infection and prevent any long-term damage. But if you don't treat early, of course, it will result to long-term damage, okay? Another reason testing matters is not just for yourself, but for others too, since syphilis spreads through contact. Rico, syphilis spreads through contact. Okay? mm-hmm. Knowing your status helps prevent passing it to partners. It's also important for pregnant women because untreated syphilis can affect unborn babies. Okay? Syphilis is a condition that shows why regular health checks are important. It can start silently, progress slowly, and become serious if ignored. But with awareness, testing, and proper treatment, is usually completely manageable. Okay, completely manageable. So make sure you watch that video, Rico. Okay, it will explain to you everything you want to know about syphilis. Okay, Rico, which other sexual infection do you know? Which other one do you know? Which one do you know? Mm. And any question, you can also comment on the video when you're done watching that video, okay? Okay, Rico. Hey there, hey there. So we were done with with reviewing the first video. I want us to review another video, which is inside her body. I've told you that one is also a playlist, a different one. The one that has a title Fibroid Solution, A New Hope. Yeah, Fibroid Solution. Hope you've seen that video. Let me read for you the description so that you know which one it is. Mm-hmm. So the title is The Fibroid Solution, A New Hope. Okay? Inside Her Body Part 2. This is the second part of the Inside Her Body series. We dive into hope and effective treatment for fibroids. So, yeah. Fibroid Solution. This one has so few views. So many people have not watched this one. Okay? But I see some good comments here for those who have watched. So if you've not watched, make sure you watch it. So we are going to review it though. Okay? Yes, Rico. Yes, Rico. You say first. Talk to me. Talk to me. Julie, did you have fans in Kenya? Yeah, I have them. I have some fans here. So many of them. Why? Why, Rico? Why? What is Rico saying? Did they know you did they ask you, can I have a picture? You want to see their picture, or what do you mean, Rico? Hi Jahanara. How are you doing? What's up, Jahanara? Kindly give me your likes. You're so much welcome. Welcome in today's live. What's up? Yes, I'm okay. What about you? How are you? So So if the fans ask you that, the fans can have a picture with you. Oh, okay. Of course I can. Of course I can have a picture with them. I can't deny them a picture. I can. Jahanara, give me your likes, my dear friend. Thank you for joining us. We are having a we are reviewing our videos here. We've just reviewed our one of our videos. Okay, we are going to start reviewing the second one. So you're most welcome. Make sure you engage, interact, and make sure you watch the video after the live stream. Okay. So I've told you the title of the video we are going to review. Okay. So when we talk about fibroids, medically known as uterine fibroids, okay, I don't know, Rick. I don't know what he means by that. Jahana, what do you mean? So when we talk about fibroids, medically known as uterine fibroids, we're talking about non non-cancerous growths that develop in or around the uterus. Okay, they're actually very common, especially among women of reproductive age. But the experience can be very different from one person to another. Okay, some people may have fibroids and never even know, while others go through serious symptoms like heavy menstrual bleeding, pelvic pains, pressure in the lower abdomen, frequent urination, and in some cases difficulty in getting pregnant. Okay, the fibroids are so, like, most people, like the ones I've seen or maybe heard or maybe I know, they always experience very painful, like their fibroids is very very painful. Hmm? Hmm. They're actually like very common. Okay, breastfeeding, Jahan is what about breastfeeding, Jahanara? Pitman, hello. You're so much welcome, Pitman. Kindly give me your likes. How are you today? Long time. Hope you got better, Pitman. Thank you for joining today. We are reviewing our videos here. He means yours. Oh, Jahanara, are you okay? Are you okay? Yo, anyway, let's continue. Let's continue. So we've seen that some people may have fibroids and never even know, while others go through serious symptoms like heavy menstrual bleeding, pelvic pains, pressure in the lower abdomen, frequent urination, and in some cases, difficulty getting pregnant. Okay? So when we say fibroid solutions, we're not talking about just one answer. It's about understanding the different options and what gives hope today. Okay? Yes, yes, guys. For those who are just joining, like the live stream, guys. If you are new, make sure you subscribe. And if you know anything about fibroids, let us know. And if you don't know, make sure you watch that video to have like idea of what fibroids is. Okay, if Jahan is doing one more time, I'm gonna manage. Okay, Rico. Okay, okay. So first, let's talk about the traditional approach to fibroids, okay? For many years, treatment often depended on how severe the fibroids were. Doctors would monitor small fibroids if they were not causing symptoms, but if they became large or painful, treatment options included medication to manage symptoms or surgery, okay? One common surgical procedure is Yeah, yeah, yeah. Yo, I don't know how to spell this. Yomectomy, where fibroids are removed but the uterus is left intact. Okay, have you heard of anyone who has removed the fibroids? Who has had surgery to remove those growths of fibroids? Huh? As for me, I've heard of so like not so many, but some people close to me who have had. Okay, I banned him. He was saying some such things to you. Okay, Rico, no problem, no problem at all. It's fine. So I was saying, I know some people who have had fibroids, and they say it's a very painful experience, and most of them are still living with that condition. You guys know the famous Lupita Nyong'o. She's Kenyan. You know her very well. She also has fibroids until now, until today. Okay, she always talks about it in shows and stuff, how it's a very painful experience and stuff. Okay, if you don't know her, you can even follow her up and see how she explains fibroid. But make sure you also watch our videos to get clear information. I like your okay, make sure you do. This is often preferred by women who still the removal of the fibroids. Okay, is often preferred by women who still want to have children. Another more serious option is oh my god, hysterectomy. Which is the complete removal of the uterus. Yeah, some go for complete removal of the uterus. They remove the whole uterus because of fibroids. Can Pitman speak English? I don't think so. I don't think he can speak English. That's why he never like speaks. He never comment in words. Okay. Uh-huh. Yeah, I've told you of another more serious option, which is the removal of the whole uterus. Okay, while it permanently solves fibroids, it also means the person can no longer become pregnant. So it's a major life decision, major one. Now when we say a new hope, okay, we are talking about the more modern, less invasive treatments, and are changing how fibroids are managed. Okay, are managed today. One of the biggest breakthrough is a procedure called uterine fibroids embolization. This is an unsurgical treatment where doctors block the blood supply to the fibroids, causing them to shrink over time. It doesn't require major surgery, and recovery is usually faster. I'm just the only one here. Yes, Rico, you're the only one here. Pitman, I think Pitman has left already. Pitman, are you still around? So, I'm just okay. There are also advanced medications now that help regulate hormones. Because fibroids are influenced by hormones like estrogen, these medications can help shrink fibroids or control symptoms like heavy bleeding, giving people relief without immediately going into surgery. Okay. Another emerging option is focused ultrasound therapy, where sound waves are used to target and destroy fibroid tissues without cutting into the body. Okay. So here surgery is not even needed. Are you, Dr. Julie? Good question. I'm not, but we're just having a discussion about fibroids, because having a discussion about these health videos, I'm not really one. Okay. Azim. Mm-hmm. So we're talking about another emerging option is focused ultrasound. That one that it doesn't need surgery, but yes, Rico. Yeah. Okay. Focused ultrasound therapy, where sound waves are used to target and destroy fibroid tissues without cutting into the body. So this is still developing in many places, but it represents a shift towards safer and less invasive care. Okay, beyond medical treatments, so Rico, relax, okay? Beyond medical treatment, lifestyle also plays a role in managing fibroids while it may not completely remove them, okay? Maintaining a healthy diet, managing stress, and keeping a balanced weight can support overall hormonal health and may help reduce symptoms severity, okay? So in this video, we see that they are also talking about a new hope. Okay, so why do we say a new hope? Because in the past, many people felt like their only option was major surgeries. Okay, today there are more choices, more awareness, and more ways to manage fibroids depending on individual needs. People now have the opportunity to detect fibroids earlier. Okay, explore less invasive treatments and make informed decisions about their bodies. Okay, Rick, what are you saying? The new hope is only Jesus, my sister. Even on fibroids, we're talking about this condition which requires medical attention. So talking of the new hope, we're talking about the modern ways of treating these fibroids that have been implemented that are less effective. Okay, Rico? The only hope is Jesus. I know. Even when you're sick and you go to the hospital to get treatment, you get treatment at the same time praying to God so that the treatment can work on you. Okay? Hope you get my point. Rico, are we together? So the key message here is that fibroids are common, very, very common. They're treatable and no one should feel stuck or hopeless. If someone is experiencing symptoms, the best step is to seek medical advice, get proper diagnosis, usually through ultrasound, and discuss the available options. Okay? In the end, a new hope doesn't mean there is one magic cure for everyone. It means there are better, safer, and more personalized solutions than ever before. And that gives people real control over their health and future. Okay? Yeah, so that video explains so well about fibroids, and this is something people have to be cautious about. Know the cause, okay? Know the cause, know the treatment, and everything. It's not just about female or anything. It's about both of us, because you have a sister in your life, you have a mother, you have maybe a girlfriend, a wife, any that you have, any lady, you have a daughter, and they might go through this or be going through this. So the video will help you understand what it is, how to take care of them, what to do, best treatment method and stuff. Okay, so it's good to know. So good to know. Which other video should we review, guys? Give me your comments. Which other video should we look at, Rico? Which one have you watched? Yeah, I'm just here, me and Rico. Me and Rico, me and Rico. What other video should we talk about? Rico, suggest one. Suggest one that you've seen on the channel. Lioness Hunt Hippo, the battle. But today, Rico, we are looking at the health videos. So you've watched that video. That is so amazing. Mm-hmm. What time is it in Kenya? Right now, Rico, it's 4 p.m. 4:38 p.m. right now. Okay. Mm-hmm, mm-hmm. So Rico, now let's review our videos. Like we have two videos. I think I should just review them like once, both the two health videos. What is the PM and AM? You know, AM is the morning hours. You know that. PM is the afternoon and evening hours. Rico, really, you don't know AM and PM? Yes, so I'm going to talk about diabetes 1 and 2. Uh-huh. Treatment, prevention. Okay, Rico, because we have a video of diabetes 1, diabetes 2, and how to control them. So we just better discuss them in one. Or what do you think? What do you think? Yeah, both the 1 and 2. Yes, Rico. So, of course, a lot of people hear about diabetes 1 and 2 and they don't really understand the difference. Yeah, I know even you, Rico, you don't know the difference. You just know there is type 1, type 2. Yeah, how it affects the body, how it can be controlled. Some people even think diabetes is just about too much sugar. But it's much deeper than that. Even me, I used to know diabetes is just all about sugar, a lot of sugar. Mm. So let's look at what diabetes actually is, the difference between type 1 and type 2 diabetes, what it does to your body, how to control it, and the treatment options available today. Okay? So what is the, like, these videos, the 1 and 2 both explains what diabetes condition is, of which we see that diabetes is where the body, the body, oh my god, the body cannot properly control blood sugar levels. Okay, now blood sugar, also called glucose, in your body's main source of energy. Every time you eat, your body breaks down food into glucose, which enters your bloodstream. Okay, to move that sugar into your cells, your body uses a hormone called insulin. Think of insulin like a key. It opens your cells to sugar, can enter and be used for energy. When diabetes happens, two things can go wrong. Either your body doesn't produce insulin, or your body cannot use insulin properly. That is what leads to high blood sugar levels, and that is where problem begins. Okay, either your body doesn't produce insulin, or your body cannot use insulin properly. That is where the problem of diabetes starts from. Okay, so when you talk about type 1 diabetes, is usually starts in children or young people, but it can happen at any age. Okay, but usually children or young people. Okay, type 1 diabetes is an autoimmune condition, which means the body's immune system mistakenly attacks the cells in the pancreas that produces insulin. So basically, the body destroys its own insulin producing cells. Most people think we have 72. Most people think we have 72 gingers. 72 gingers, Rico. What is gingers? What is gingers, honestly? I don't know what ginger is. Gingers, or what do you mean with when you say gingers? So we're still on type 1. So basically, the body destroys its own insulin producing cells. As a result, insulin is no longer produced. Okay. Oh, genders. Oh, which people think that? How can we have 72 genders, Rico? That is impossible. So we see that without insulin, sugar cannot enter the cells, so it builds up in the bloodstream. This is still on a type 1 diabetes. Okay, so symptoms of type 1 diabetes, the video says it's extreme thirst, frequent urination, sudden weight loss, fatigue, blurry vision. Type 1 diabetes develops quickly, sometimes within weeks. People with type 1 diabetes must take insulin every day. There is no way around it because the body cannot produce it anymore. Well, the people who are gay think we have 72 genders. Why? Why do they think so? Why? We have only two genders, men and women. Yeah, that is true. Only two. You're either a man or you are a woman. Okay? So, Rico, if you want to know more, on the videos we have type 1 diabetes, we have type 2. Different, those are two different videos, okay? They think, fury or a cat or something. How can a cat be human? How? Those are not human beings. 1 minute Mm-hmm. I'm back, guys. I'm back. Rico, I see you're still here. We have only, yeah, they think I'm waiting. I'm here now, Rico. Julie, is it really you? It was 2000 years that I said. 2000 years? Rico, what do you mean? Why am I not getting your point? Julie, is it really you? It was 2000 years that I see you live. Like it's been long, or what do you mean? Been long since you saw me live. It's me. This is me. This is me. I've not even changed a little bit. Anyway. Mm-hmm. We continue now. So we were on diabetes. We've seen diabetes 1, and now we're going to diabetes 2. Diabetes 2 explained. Okay. Mm-hmm. Yeah, type 2 diabetes. Okay, Rico. It should be a sure. I get it. Now let's talk about type 2 diabetes, guys. Okay, Rico. Since you're the only one here, I'm addressing you. I'm addressing you, Rico. So type 2 is the most common type of diabetes. Okay? It's the most common. Okay. So this one usually develops over time, right? Especially in adults, but it's now becoming more common in young people too. Okay? In type 2 diabetes, we see that the body still produces insulin, but it doesn't use it properly, right? It produces insulin but doesn't use it properly. This is called insulin resistance. At first, the body tries to compensate by producing more insulin, but over time, it can't keep up and blood sugar rises. Okay? So risk factors in type 2 diabetes are unhealthy diet, lack of physical activities, being overweight, family history. It's also inherited. If your family has the history of having diabetic people, you can inherit. Okay? Yeah, Rico, we've not moved. We've not moved. Still at 55, 60, but no problem. No problem. We will just move, don't worry. So symptoms of type 2 diabetes are okay, sometimes there are symptoms at first, but as it progresses, tiredness, increased thirst, slow healing wounds, frequent infections. Hi, beautiful queen, looking gorgeous and fine. Michelle, Aurelia, how are you doing, my sister? So nice to see you. Rico, this is my sister, Michelle Aurelia. That is my sister. I think they hate this new update of texting, or they're forgetting you. I guess so, Rico. Too bad. But they'll just come around. They'll just get used to this. It's just that it doesn't show them. It doesn't give them notification. Okay. Michelle Aurelia, how are you doing? Rico, this is my sister. How are you doing today, baby girl? Thank you for joining. Stay here mpaka tumalize. Sawa. Thank you for coming around though. We are talking about diabetes. Okay? We've looked at diabetes 1, type 1, and we are now looking at type 2. We are on If you want to know more about this, Michelle, we have videos on the channel, type 1 and type 2. So go check them out. We are reviewing them, the videos. Okay, Michelle Rico is saying hello to you. So let's look at what diabetes does to the body. If diabetes is not controlled, can affect almost every part of the body. Okay. Who else has joined us? Who else is here? If not controlled, it can affect almost every part of the body. Okay. So one, heart and blood vessels. I'm good. Okay, that is nice, my girl. Thank you so much for coming around today. Sawa, I'm so happy to see you. So diabetes can cause heart and blood vessels, can affect, not cause, affect heart and blood vessels. So we see that high sugars damages blood vessels, increasing the risk of heart disease and stroke. Okay, it affects eyes. It can lead to vision problems and even blindness. Ooh, that is bad. Kidneys. Diabetes is one of the leading causes of kidney failure. Nerves. It can damage nerves, causing numbness or pain, especially in the feet. Yeah, by the way, you guys have seen diabetic people who have whose feet are so painful. Okay, and numbness, they don't feel anything in the feet. It has become so numb. Okay, immune system, it weakens the body's ability to fight infections. This is why controlling diabetes is extremely important, guys. Very important. Zaki, VIP, Queen, Desert, they're all forgetting you. Rico, really? Zaki, VIP, Queen, and Desert. I miss them. I miss them so much, so much. I hope they come around. I hope they do come around soon. Oh my God, what is here? Anytime, girl. I will talk to you later. Okay, Michelle, no problem. Thank you so much. Thank you for passing by. I appreciate so much, so much. Okay, so we've seen yeah, she says she's leaving. She's going, Rico. We are now remaining here, just me and you again. Yeah, we've seen what diabetes does to the body, and now let's see how to control diabetes. Rico, have you seen someone who is diabetic, or have you heard of someone who is diabetic? Anyone close to you? Anyone you know who is diabetic? Huh? Anyway, how to control diabetes? Huh? Controlling diabetes, whether it's type 1 or type 2, managing diabetes is possible, very possible, by the way. One, healthy eating. You have to eat healthy. Those videos explains everything, the healthy eating also. So food plays a huge role. Okay, focus on vegetables, whole grains, lean proteins, very important. Reduce sugary drinks, processed foods, excess carbohydrates, and okay, yeah, and excess carbohydrates. Okay, another way of controlling diabetes is exercise. Physical activity helps your body use insulin better. Simple things like walking, jogging, dancing can make a big difference, by the way. Monitoring blood pressure. Regular checking helps you understand what affects your sugar levels, okay? So you should always check on your, manage your weight, okay? Check on your weight. Okay, like my check on your blood pressure. Weight management also. For type 2 diabetes, even small weight loss can improve control. Okay, stress management. Stress can increase blood pressure levels, so relaxation is very important if you have diabetes, whether type 1 or 2. I think no, she's going. I think not. Yeah, but I think she's gone, Rico. Maybe she'll come back. Why is Michelle number 3? She should be number 2. I don't know who is number 2. Let's see who is number 2, Rico. Yes, it is dangerous. It is dangerous, but there is precautions, and there is some, yeah, some precautions you can take for controlling them. Controlling diabetes, you can control, but it's dangerous if you don't take care and you don't control it, okay? Mm-hmm. Who is the second one? Number 2 was Pittman. I guess he's still number 2. Yeah, I think he's still number 2. That's why Michelle number is number 3. Mm-hmm. Rico, let's see. Let's Hey guys. For those who have just joined, you're so much welcome. We are discussing here about diabetes. We've looked at type 1, type 2. Okay? We are now on treatment options. Julie, you're stealing my crown. Yo, sorry. I can't steal your crown though. Can't steal your crown. You see, I now have the number 3 crown. You still have number 1. You still have crown number 1. Yeah, you see. Okay. Treatment of options for diabetes, both for type 1 diabetes. You should go for daily insulin injections or insulin pump. Okay, daily. Blood sugar monitoring, and simply implement healthy lifestyle. Okay, for type 2 diabetes, lifestyle changes, that is diet plus exercise, oral medications, sometimes insulin, those insulin injections. There are also never medications that help control blood sugars and protect the heart. Newer, not never. There are newer medications. So, diabetes is serious, but it is manageable, okay? It is dangerous, Rico, but it can still be manageable. The key things to remember: early detection is important, lifestyle plays a huge role, treatment is available, and with proper care, people can live long, healthy lives. Rico, do you know anyone living with the diabetes? Anyone you've seen living with diabetes? When are you going offline and when are you going live again? When am I going offline? Mm-hmm. Maybe 7 p.m. Yeah. Maybe 7 p.m. and I'll be live again next week. Next week on Tuesday. Official blood guy, hello. Official blood guy is here. How are you doing, my good friend? So nice to see you here. Kindly give me your likes. Give me your likes. You're so much welcome. How have you been? I don't think I know a diabetes person. Oh, okay. Okay, Rico. And which food do you guys think raises blood sugars the most? Which foods do you guys think raises blood sugars the most? Which one do you think? Which one? Which one? As for me, I think processed foods, most of the processed foods, junk foods, raises blood sugars the most. What about you? Ice cream. Oh yeah, that is so true, so true. I also think so. Official blood guy. And you guys check your blood sugars, by the way. I think Coca-Cola. Yeah, that is true. Sodas. Yeah, this soda, not only, yeah, soda, yeah, that is true. I also think so. Do you guys check your blood pressure? Do you check your blood pressure? Have you ever checked your, if you're diabetic or not? Have you ever like just been curious to go and check your status on diabetes? And chocolate, yeah, chocolates too. But I love chocolate. I love chocolates. Yeah. So guys, that is all about our video of diabetes 1, diabetes 2. Make sure you watch. Let me just show you diabetes 1 and 2 videos. Yeah, we have both of the day of both 1 and 2. Make sure you check, okay? Make sure you watch. Mm. Yes, official blood guy. Now blood guy left. Oh, blood guy has not left. He's still here. Blood guy. So the reason why we're reviewing these diabetes 1 and 2 is because we have those videos here, and if you really want to learn more about diabetes, kindly check those videos, okay? Check them, check them. You was for a second gone and you're back. So guys, we have so many health videos. If you've watched any one of them, you can let us know so that we can review that one. Okay, I'm reviewing the ones I've watched and the ones I can explain. Yes, for those who are just joining, kindly like the live stream. Like the live stream. If you are new, subscribe. Kindly. Okay. Is this you, mother? Who, Rico? Now for people. Yeah, better now. And make sure you engage, guys. Okay? Make sure you engage. Be active at least. So another video I want us to look at, to review, is oh, okay, that is my cousin. That is my cousin. She's here with me. Okay. Yeah, she's here with me. Kuja salimia watu, kuja explainia watu. Ama nigeuze kamera. She doesn't want to say hello, eh? Yeah, better. So, yes, fluent. In fact, she's a doctor. In fact, she's a doctor. She's a physiotherapist. Kuja salimia watu. She's a physiotherapist, okay? So the other video I want us to review, guys, is the title of this video is Unlocking the Truth, what you need to know about gonorrhea in 2025. We've looked at syphilis, right? We've talked about syphilis. That video, make sure you watch it, Rico. Make sure you watch that video. Now 3 again. Yeah. Better, at least it's adding up something. Okay? So, let me read for you the description. In this educational video, we dwell into the world of sexually transmitted diseases, specifically focusing on gonorrhea, a common sexual transmitted disease that affects millions of people worldwide. In 2025, it's essential to stay informed about the latest developments and research surrounding this STI. Our goal is to provide you with a comprehensive understanding of gonorrhea, its symptoms, treatment options, and prevention methods. By watching this video, you will gain a deeper insight into the importance of sexual health and the steps you can take to protect yourself from this potentially debilitating disease. Whether you are looking to learn more about gonorrhea for personal or professional reasons, this video aims to provide you with accurate and reliable information, making it an invaluable resource for anyone interested in educational content about STDs and STIs. Okay? For those who are just joining, like the live stream, okay? Julie, yes, Rico, what's up? Hey, I'm back. Samaya, welcome back. How are you today? How is your weekend? I need to go see you tomorrow. Bye. I won't be live tomorrow, Rico. Come on, how is life? Not bad, Samaya. We're trying. Welcome. Where is Inaya? Where is Inaya today? Huh? Where is your sister? So guys, let's start on that, huh? Okay. So we start with knowing what is gonorrhea first. You guys, what is gonorrhea? Inaya, Samaya, what is gonorrhea? Do you know gonorrhea? We are going somewhere, so she's busy. Oh, okay. Say hello to her. Okay. Where are you guys going? You didn't invite me for Ide. You guys didn't invite me. Why? Anyway, hope you enjoyed your day. Hope you enjoyed, guys. Okay, we are talking about gonorrhea here. Do you know gonorrhea? What is gonorrhea, Samaya? Have you ever heard of gonorrhea? So, we see that gonorrhea is a sexually transmitted infection caused by bacteria. Okay? All right, nice saying hello. Thank you. Thank you so much. Gonorrhea is sexually transmitted infection, okay, caused by bacteria. It spreads mainly through unprotected sexual contact, including vaginal, oral, and anal sex. Okay? The bacteria that causes it is called Neisseria gonorrhoeae. Once this bacteria enters the body, it targets warm, moist areas such as the reproductive organs, the throat, the rectum, the urinary tract. Okay? Alright, have to go. Bye. Okay, Samaya. Bye bye. Have a nice time. And enjoy the rest of the day. Who else is here, guys? Who else is here? As you listen, you also engage. Let me know what you know. Okay? And if you don't know, make sure you watch this video on this channel. Kindly. Mm-hmm. So we're seeing that once the bacteria enters the body, it targets warm, moist areas, such as the reproductive organs, the throat, the rectum, the urinary tract. Okay? What makes gonorrhea tricky is that many people don't know symptoms at all, especially in the early stages. That means someone can have it and pass it on without even knowing, right? Okay, guys. So how does gonorrhea spread? This video explains how gonorrhea spreads, okay? Of which it spreads through unprotected sex, contact with infected bodily fluids, from mother to baby during childbirth. It does not spread through casual contacts like hugging, sharing food, sitting next to someone. This is important to clear up because there are many myths around it. Okay? So what are the symptoms? Symptoms of gonorrhea in your body. Who is here? I see one person is here with me. What are the symptoms? Symptoms of gonorrhea in your body. Symptoms of gonorrhea, guys. Symptoms of gonorrhea. So we see that the symptoms can appear differently, okay? Depending on the person. In men, burning sensation when urinating, discharge from the penis, pain or swelling. Okay, in women it's increased vaginal discharge, pain during urination, lower abdominal pains, bleeding between periods. I don't know how to explain that. However, many women may have very mild symptoms or none at all, which makes it harder to detect early. Other areas is if the throat is infected, you can have sour throat. If the rectum is infected, discomfort in the rectum, discharge pain. Okay? Okay, guys. So what does gonorrhea does to our bodies? If left untreated, gonorrhea can cause serious complications. In women, it can lead to a condition called pelvic inflammatory disease, which can damage the reproductive organs and may lead to infertility. Infertility, the woman can't be able to get pregnant. Okay. In men, it can affect the tubes connected to the testicles, causing pain and sometimes fertility issues. Right? In both, the infection can spread into the bloodstream, which becomes more serious and affects joints and other parts of the body. In men, in both women and men, okay, the infection can spread into the bloodstream, which becomes more serious and affects joints and other parts of the body. It can also increase the risk of getting or spreading other infections like HIV. Yo, gonorrhea can increase the risk of getting or spreading infections like HIV. So you people, you need to really take care. Okay? Why testing is important, guys. You really need to test. If you see any of those symptoms we've read here, you need to go for a test. One of the biggest problem with gonorrhea is that it can be silent. Okay, that is why testing is very important, especially if you're sexually active, you have a new partner, you notice unusual symptoms. Testing is simple and may involve urine samples, swabs from affected areas. Early detections makes treatment much easier and prevents complications. Okay, so when you see any of those symptoms, you really need to go for a test, and make sure you watch the video to know more. Right? One challenge today is that some stains of gonorrhea are becoming resistant to certain antibiotics. They're becoming resistant. That is why proper medical treatment is very important, not self-medications. Okay? Okay, guys, who is here? I have 0 people. I want us to look at now the preventions of gonorrhea. So guys, let's look at prevention. Yeah, prevention of gonorrhea. We see that preventing gonorrhea is possible with simple steps. First, use protection during sex, guys. Use protection, very important. Get regular health checkups. Limit multiple sexual partners. Communicate openly with partners. Okay, prevention is always better than treatment, guys. Not that. We see that gonorrhea is so common, but it's also preventable and treatable. The dangers comes when people ignore symptoms or avoid testing. Okay, the earlier it's detected, the easier it is to treat, and the less damage it causes. Taking care of your health, staying informed, and making safe choices can protect not just you, but others as well. Okay, so guys, did you know some infections show no symptoms, like gonorrhea? We've seen at the start, at the beginning, it's like when it enters your body, there is no signs. It stays in your body and you're not seeing any signs. Okay, why do you think people avoid testing gonorrhea, guys? They're afraid of the truth, of facing reality. Hmm? Hey there, hey there. Mm, 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 mm. Anything you want to add up, guys, about gonorrhea? Anything you know? Common myths you've heard about gonorrhea, guys? Let us know. Let us know. Let us know kindly. Let's interact with that. Let's talk about it. Let's talk about it. Let's talk about it. What do you think? Anyway, we can talk about any other another one, another health video, another health video that we have here. Mm-hmm. There is one I wanted to talk about, but you guys will say it is for females. Rico will ask me, is it only for women? Hey there, who has joined us? Who has joined us? I see one person is here. Desert, hello. How are you doing, Desert? Rico was just talking about you. Rico was just saying Desert has forgotten me. Desert is not coming around. Thank God you're here. How are you today? How are you today, Desert? Desert, today we are doing video reviews again, but we are reviewing our health videos. We've reviewed a video of explaining the one on syphilis, explaining syphilis. We've reviewed the one of diabetes. We've reviewed the one with the one explaining gonorrhea. Kindly watch that video, Desert. It's so educative and so good. Have you watched any of our health videos, Desert, so that we can review it? Which one have you watched? What is happening? Hmm. Hey there, who is here? Hmm. Kuachana na ulevi na vile ni vilabu zimejaza na so guys, I want us to review another video. Another video of the title is how to eat healthy food. Have you come across that video on our channel, guys? Who has come across that video? How to eat healthy food. Who has come across that video, guys? Hmm? Who has come across that video? So now, guys, a lot of people think okay, just to start, that eating healthy, it's just explaining how you can eat healthy, how to balance your meals and stuff. Okay, so now, you know, a lot of people think eating healthy is expensive, boring, or only for people trying to lose weight, right? That is what most of us think. Most of us. But that is not true at all, because eating healthy is really about taking care of your body, having more energy, and preventing diseases, right? So in this video, it we in this video breaks down eating healthy in very simple way. Okay, what eating healthy, what healthy eating actually means, what foods to choose, what to avoid, and how to make it practical in everyday life. Okay, so what does eating healthy really mean, guys? What does eating healthy really mean? So we see that eating healthy doesn't mean starving yourself or eating less. It means eating the right kind of food in the right balance, right? Because your body needs carbohydrates for energy, proteins for building and repair, fats for energy and hormone balance, vitamins and minerals for overall health. So a healthy diet is all about balance, not restriction. Okay, give me a minute, guys. There is people passing outside. I don't know what's going on. 1 minute. It's church people. I think they're having crusade, creating awareness and stuff. Huh? They're doing their thing, creating awareness in this place, and preaching the gospel while walking around. Okay. So guys, we've seen that your body needs carbohydrates for energy, proteins for building and repair, fats for energy and hormone balance, vitamins and minerals for overall health. So basically, a healthy diet is all about balance, not restrictions. Okay, and if you're trying to eat healthy, you're trying to know all about health eating, healthy living, health lifestyle, kindly check our videos. We have all of that here. all of that. Okay. So let's look at types of healthy foods. Vegetables, guys. Vegetables are one of the most important parts of healthy eating, by the way. Skuma wiki, spinach, some of you call it spinach. We call it spinach. Okay. Carrots, broccoli. Very, very healthy. Okay. They're rich in vitamins and help protect your body from diseases. Sour. Fruits is a must do, guys. Fruits for healthy eating healthy. Fruits provide natural sugars and important nutrients. Okay, punguza volume kidogo tu, kidogo tu, kidogo tu. Fruits provide natural sugars and important nutrients. So examples are bananas, oranges, mangoes, and apples. Make sure you include fruits in your meals, guys. They're great for snacks instead of processed sweets. Proteins helps your body grow and repair itself. Sources include eggs, beans, fish, and chicken. For people in Kenya, even affordable options like beans and lentils are excellent. Even other places, I know eggs are affordable, fish, chicken, right? Whole grains, instead of refined foods, whole grains are better. So much better, guys, so much better. For example, brown ugali, oats, whole wheat bread. They release energy slowly and keep you full longer. Yeah, brown ugali, oats, whole wheat bread, yeah. Healthy fats, guys. Healthy fats. Not all fats are bad, but healthy fats come from avocados, nuts, and seeds. They support brain health and energy. Mm-hmm. Foods to reduce when you're maintaining a health eating. Foods to reduce. Sugary foods. Reduce on sugary foods. The video tells us to reduce on sugary foods. Too much sugar can lead to conditions like type 2 diabetes, of which we've talked about diabetes just a few minutes ago, a while ago, not even an hour, right? For example, soda. Soda. Rico, where are you? Yeah, you said soda. Soda, we need to reduce soda, Coca-Cola. Sweets and cakes. Processed foods, highly processed foods often contains too much salt, too much fat, additives, example chips, fast foods, and packaged snacks. You really need to reduce that, okay? Excess oil and fried foods. Too much oil can lead to weight gain and heart problems, guys. So if you are you want to eat healthy, you need to reduce excess oils and fried foods. How to eat healthy daily. Now let's make it practical. So portion control, don't overeat. Even healthy foods in excess can be harmful, very harmful. Drink water, a lot of water, guys. Water is very important. Avoid replacing it with sugary drinks. Eat regular meals. Skipping meals can lead to overeating later. Plan your meals. Think about what you'll eat in advance to avoid unhealthy choices. Balance your plate. A simple way: half plate vegetables, proteins, carbohydrates. Yeah, make sure in your meals you have vegetable, protein, carbohydrates. That is balanced, right? So guys, there's also common myths in this about healthy eating. So common, like people saying healthy food is not always expensive. That is a myth. Okay, you don't need to completely stop enjoying food. You don't have to follow extreme diets. Healthy eating is about consistency, guys, not protection. Benefits of eating healthy. Guys, what do you know? What are the benefits of eating healthy? Anyone, anyone, anyone? Anyone to tell us the benefits of eating healthy? Okay, we see that when you eat healthy, you have more energy. That is one benefit, right? You improve your mood, you strengthen your immune system, you reduce the risk of diseases. It also helps you feel better overall, both physically and mentally. So we see that healthy eating is not about being perfect, it's about making better choices every day. Start small, add more vegetables, drink more water, reduce junk foods. That is it. That is how to start, guys. The way to go. Over time, those small changes make a very big difference. Okay? Guys, what are your favorite healthy foods? Your favorite healthy foods? Your favorite go-to healthy foods? I want to hear from you too, guys. You've been hearing from me so much. Let me know, let me know, let me know. As for me, my favorite healthy meal, my favorite go-to oats. I love having or eating oats in the morning. You know, oats I add in milk. I don't add sugar, any sugar. Just milk and banana. One banana or two ripe bananas. Okay, that is my favorite in the morning. I love having fruits midday. Some proteins with rice and vegetables in the evening. That is my go-to, like, healthy meal. I love doing. What about you guys? What is your favorite healthy meal? Healthy food? Let me know, guys. Let me know. And do you guys think eating healthy is expensive? Do you think it is expensive? Mm, 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 mm. Talk to me, my people. Is it expensive? And what is the hardest part about eating healthy for you? What is the hardest part about eating healthy? As for me, it's maybe the timing, because sometimes timing. Okay, sometimes maybe when I don't have lunch, having late dinner, and you don't have to eat heavy at night, so that might be the problem, maybe my problem. What about you guys? Talk to me, talk to me, talk to me. Talk to me, my good people. Can you share lights? Can you share lights? Can you share lights? I'm waiting to hear from you. Tangu uende bado 0 people. Ijafika hata 2 hours. So guys, we're done with reviewing that video. Eating healthy. Eating healthy. Which other one should we look at? Which other one should we review, guys? Let me know. Let me know. Acne. I wanted to talk about that too, though. But I also want to hear from you. You know, very important. Very important. Very, very important. Hey there, who is here? Who has come around, guys? Let me know who is there. Hey there. Art ya kuunda art kwa nini? Polish hata si nini je. Ya kuchora art kama unataka kufanya ku art French. So guys, the other video I want us to talk about is this. The title is The Complete Acne Treatment Guide, How to Get Clear Skin Part 1. We have Part 2 also. So this is Part 1, the complete acne treatment. So here's the description. If you're tired, guys, of dealing with acne or acne and facial acne that is affecting your self-confidence, in this comprehensive guide we will take you through a step-by-step process, step by step, okay? On how to get clear skin and say goodbye to acne for good, from understanding the root causes of acne to exploring different treatment options. We'll cover it all, okay? Here on this video like covers it all. Make sure you watch it if you're dealing with acne. If not, you can just watch it to get information. You can help someone somewhere, okay? Whether you're struggling with mild, moderate, or severe acne, this video is designed to provide you with actionable tips and expert advice to help you achieve the clear, glowing skin you deserve. So if you're ready to take control of your skin and start your journey to an acne-free life, watch the video, guys. Make sure you watch the video till the end and get ready to transform your skin. Okay? So we start, guys. This acne, almost everyone experiences it at a certain point. Have you ever experienced acne? Hey there, I see one person is here. Let me know if you've ever experienced acne. As for me, I've experienced acne. Hey, hype, snippet the hype. Hey, how are you doing, my dear friend? Thank you so much for coming around. Kindly give me your likes. How is your weekend going? How is your weekend? Snipe the hype. Snippet the hype, snipe the hype, my good friend. Today we're reviewing our videos. Thank you so much for coming around. Have you ever experienced acne? Have you experienced acne at any point? Lewis, hello. Lewis, kindly give me your likes, my dear friend. So happy to see you today. How is everything with you? I'm doing good, sister. God bless you. Thank you so much, Snipe the hype, my good friend. And thank you for joining the live stream. Today our topic is like reviewing our health videos, health educative videos on this channel. We've done some so far, and we are continuing, we are going on. Thank you for joining. We are on acne, controlling acne. Have you ever experienced acne? Have you ever had acne? As for me, I've had acne. It's not, oh, it's so bad, so bad and stressing. Okay. Almost everyone has experienced acne at some point, right? I want to see. Today we're talking about acne snipe. Okay, you'll see later. I'll show you later. So we see that some people think acne is just a teenage problem, but in reality, it affects people of all ages. It can impact confidence, mental health, and even how someone interacts socially. All right, thank you. Yeah, you're welcome, my dear friend. You're welcome. Make sure you give me your likes too. It can impact, we see that acne can impact confidence, mental health, and even how someone interacts socially. So as we talk about these, we're doing a complete acne treatment guide: what causes it, types of acne, how it is treated, and how to prevent it. Okay, thank you for the likes, my dear friend. So we see that acne is a condition that happens when hair follicles become clogged with oil and dead skin cells. Your skin produces an oily substance called sebum, which helps protect and moisturize the skin. Okay, but when there is too much oil, too much dead skin buildup, bacteria, it blocks pores, leading to acne. Okay. Types of acne, guys. What are the types of acne? In this video it explains like everything. Make sure you watch that video. Who is still here, guys? Who is still here? All the types of acne, treatment, and everything. We're just like reviewing it fast. Okay, we see that not all acne is the same. There are different types. Understanding the types helps in treatment too. Blackheads, open pores clogged with oil and dirt. Those are blackheads. Okay, open pores clogged with oil and dirt. Whiteheads, these are closed pores filled with oil. Pimples. Red inflamed palms, sometimes with pus. Yeah, sometimes they have pus. Those are pimples. Nodules and cysts. These are deeper, painful, and more serious forms of acne. We see that severe acne may require medical treatment to prevent scarring. Okay? Main causes of acne are hormones. Hormonal changes, especially during puberty, increases oil production, which causes acne. Diet. Foods high in sugar and processed ingredients may worsen acne for some people too. Okay? Yeah, we see that even acne can, even diet can cause acne. Not can causes acne. Foods high in sugar and processed ingredients may worsen acne for some people. Stress doesn't directly cause acne, but can make it worse. Genetics. If your parents had acne, you're more likely to have it. Ooh. Yeah, and poor skincare habits. Using harsh products or not cleansing properly can clog pores. Okay? Daily skincare routine. This is one of the most important part, by the way. For step 1, cleanse. Wash your face twice daily with a gentle cleanser. Step 2, treat. Use acne treatments like benzoyl peroxide, which kills bacteria, salicylic acid, which unclogs pores. Step 3, moisturize. Okay? Even oily skin needs moisture. Use lightweight products to moisturize. Step 4, sunscreen. Protect your skin from sun damage, guys. Sunscreen is very, very important. Very important. Always use it. Always prevent your skin from sun damage, okay? For medical treatments, this goes for more serious acne. There is topical treatments, creams and gels prescribed by doctors, oral medications, these are by antibiotics, and hormonal treatments. Advanced treatments. For severe acne, doctors may prescribe isotretinoin, okay, which is very strong and must be used under medical supervision. Natural and lifestyle support. While not on a cure, you can drink enough water, eat balanced meals, can really help. Avoid touching your face frequently, change pillowcases regularly. Some people also try natural remedies like aloe vera or tea tree oil, but results vary. Okay? Avoid overwashing your face. Using too many products at once. Popping pimples, can cause scars. And also expecting instant results. Not possible, guys. The results can't be instant. And we see that acne treatment takes time and consistency. Time and consistency. Okay? How to prevent acne, you guys? How do you prevent acne? How did you prevent yours? You see, mine is getting off. Not too much right now. I had so many. How do you guys prevent acne, by the way? How do you prevent acne? Keep your skin clean, okay? Use Nana comedogenic products. I don't know what those products are though. Maintain a healthy lifestyle. Manage stress. Prevention, you know, is you guys know prevention is just as important as treatment, right? Very important, very important. Mm-hmm. There is also emotional side of acne, guys. The emotional side of acne. Acne doesn't just affect the skin, it can affect confidence and self-esteem. That is what we see here. We see that it cannot just affect the skin, it can affect also confidence and self-esteem, of which that is very, very true. Mm-hmm. It is important to remember acne is common, very, very common. It is treatable. It does not define your worth. Okay? It is normal, very normal. So you should not let it affect your self-esteem. Yeah, we see that acne is normal, but it can be managed with the right knowledge, patience, and care. There is no one size fits all solution, but with consistency, most people see improvements. Of course, you can see improvements on mine. So guys, we've seen types of acne. You guys, which type of acne are you struggling with? Let me see which one was mine. Which one was I struggling with? Which type of acne? I think it was both blackheads and whiteheads. Open pores blocked with oil, or closed pores filled with oil. Yeah, that type, that one, that one. What about you? Which type are you struggling with? And what controls did you take, guys? Let me know, guys. Let me know. Waiting to hear from you. Huh? Talk to me. Talk to me. Yeah, I've asked you guys what products have worked for you. And do you think diet really affects acne? Do you think so? What do you think? What do you think? What do you think? Huh? What products have worked for you guys? on your type of acne. Anyway, we continue. Which other video should we look at? Which other video should we review, guys? Which one? Let us know. So guys, the other video I want us to review is how effective is the birth control shot Depo-Provera. Okay. So this is the birth control shot, also called Depo shot or Depo-Provera. It is an effective way. Who is there, guys? You're so much welcome. Make sure you like the live stream and you're welcome. Okay. Is an effective way to prevent pregnancy, although there are some serious debates and misconceptions about it. But how does it work? You're going to find out in this explanation, and make sure you watch the video so that you get a better understanding. You know, we're just reviewing the video. Okay. What is Depo-Provera, guys? Do you know Depo? Do you know Depo-Provera? The birth control shot. So it is a very popular, by the way, and important method of birth control. Very popular and important method of birth control. The injection, specifically Depo-Provera. Okay. A lot of people have heard about the shot, but many doesn't fully understand how effective it is, how it works in the body, its benefits, and also its side effects. So we're going to break it all down in a simple, honest, and detailed way. Okay, so make sure you engage. The birth control shot is an injection that a person receives every 3 months to prevent pregnancy. It's called Depo-Provera, okay? Contains a hormone called progestin, which is similar to the natural hormone progesterone in the body. Once injected, this hormone stays in your system and works continuously for about 12 to 13 weeks. Okay? So the shot prevents pregnancy in three main ways. It stops ovulation, like completely stops ovulation. It prevents the ovaries from releasing eggs. Okay? And we all know if the egg is not released, no fertilization will take place, right? So it stops ovulation. Thickens cervical muscles. This makes it difficult for sperm to reach an egg. Okay? When it thickens cervical muscles, makes sperm so difficult to reach the egg. It thins the uterine lining. So we see that, like, when it thickens uterine lining, even if fertilization somehow happens, it makes it hard for pregnancy to develop. How? So let's see how effective it is. When used correct, we see that when used correctly, that is getting the shot on time every 3 months. Depo-Provera is over 99% effective. So it's effective, that it's effective. With typical use where people may delay or miss shots, it's about 94% effective. That means out of 100 people using it, about 6 may get pregnant in a year with typical use. Okay, so overall we see that it's considered a very reliable method of birth control. So if you want to get to understand well birth control, reviewing this video is so much good to you, and you also need to go and watch that video to get a better understanding. Okay, benefits of the shot. It is convenient. It is convenient. Obviously, you only need it once every 3 months. No daily pills. So that means it's convenient, right? Privacy. No one needs to know you're using it. No one will know you're using it. So privacy, obviously, because it's just a shot. You just injected. It's an injection. Okay. Reduced periods. Some people experience lighter periods or even no periods at all over time while using Depo-Provera. Okay. Less cramping also. It may reduce menstrual pain. Depo-Provera reduces menstrual pain. Long-lasting protection. Once injected, you don't have to worry daily. Okay. Side effects. Let's look at the side effects of Depo-Provera. Irregular periods, especially in the first months. Ooh, spotting, longer or shorter cycles. Some people eventually stop having periods. Those are the side effects of irregular periods. These are the side effects, okay, of Depo. Weight changes. Some users report weight gain over time. Mood changes. Hormones can affect mood, though it varies from person to person. Okay, it varies, but mostly changes, mood changes. Delay in fertility return. After stopping the shot, it may take several months, sometimes up to a year, for fertility to return. Yeah. Bone health. Long-term use may reduce bone density slightly, which is why doctors sometimes monitor long-term users. So using it for long may affect your bone health. Okay, so let's see those who should consider using Depo. It may be a good option for people who want long-term protection, those who forget daily pills, people looking for a private method. This is a very good option for you, for them, or for you. Who should be careful to use Depo-Provera, guys? It may be ideal for everyone, but people should consult a doctor if they have certain medical conditions, if are concerned about side effects, wants to become pregnant soon. You should be careful with it, okay? And you know, everything has a myth, and common myths on Depo-Provera are: it does not cause permanent infertility, okay? Some people say it causes permanent, so it doesn't cause permanent infertility. Does not protect against infection, guys. Take note. It does not work instantly. Timing matters. The shot protects against pregnancy, but not against infections like HIV. So protection like condoms is still important for overall sexual health, okay? So Depo-Provera is highly effective, convenient birth control, but like any medical option, it comes with pros and cons. The best choice always depends on your body, your lifestyle, and your goals, okay? Okay, guys. Which one do you prefer, Depo-Provera or daily pills, guys? Any myths you've heard about the injection Depo-Provera? Any? As for me, I've not had any, and I've not even tried any. Which one have you tried, guys? Tell us which one works for you that we should try. Hey there, who is here with me? Who is here? I see one person around. Tell me, which video should we review next? One last one to review. Hey there. Like the live stream as you come in. If you're just joining, like the live stream, guys. Let me see which one to review next. Which one? Which one, guys? Let me know. Let me see. Mm-hmm. Hey there, hey there. So another video I want us to talk about is YouTube. Is there is this video. Where is it? Yeah, it's here. The title is hormonal IUDs, guys, and make sure you go and watch these videos kindly. The videos we are reviewing very important and very educative. Okay, hormonal IUDs, what really going on inside her body, part 4. So in this video, guys, you get to learn all about the hormonal IUDs, or coil as people call it. This is part 4 of Inside Her Body series, coming to you every Sunday. Okay, Inside Her Body we have part 1, 2, 3, 4, 5, and 6, I think. Yes, so you just start from part 1, part 2, part 3. So this is part 4. Okay. So guys, we see that this is something so many people use, but they don't really understand, right, what hormonal IUDs are. So as you can see, even our title says what's really going on inside, because from the outside it just seems like a tiny device, but inside the body a lot is happening, right? So in this video we're going to break it down step by step, what it is, how it works, what it does inside the body, how effective it is, and what you should know before using it, guys. Okay, and you should, when you go to have it or to get it, you make sure the doctor even explains to you everything, so that you choose what you're okay with. Okay, and you know what you're going for. So we see what makes it hormonal is that it releases a hormone called, oh my god, levonorgestrel, a type of progestin. Okay, so the IUD is inserted into the uterus by a trained healthcare provider. It's placed through the cervix into the uterus, where it stays in position. That is how it's inserted. Oh my god. After insertion, so after insertion, it starts releasing hormones slowly. It begins working almost immediately or within a short time. Some people may feel cramping at first, but this usually settles. Okay. So let's see what really happens inside. Okay, according to our that topic of the video. So inside there is hormone release. The IUD continuously releases small amount of levonorgestrel directly into the uterus. Okay, so this is different from the pills because the hormone acts mostly locally inside the uterus. Only small amount enters the bloodstream, very small. So there is thickening of cervical muscles, where the hormone thickens the mucus at the cervix. Okay, this makes very difficult for sperm to pass through. So even before sperm gets inside, there is already a barrier. Thinning of the uterine lining, there is that one also happening inside. The lining of the uterus becomes thinner over time. This means that it's harder for a fertilized egg to attach, okay? And periods often becomes lighter, very light. So there is also possible ovulation suppression. In some people, ovulation may be reduced or stopped, but this is not the main mechanism, okay? No, no. So we see that the hormonal IUD, it creates an environment where sperm struggle to survive, okay? Even the uterus is less prepared for pregnancy, fertilizations become very unlikely. So we see that, let's see how effective it is. Hormonal IUDs are over 99% effective. That is just 100%, making them one of the most reliable birth control methods. Once inserted, no daily action is required, no frequent reminders. This makes it very convenient. The benefits: long-term protection, works for years without needing replacements, okay? Lighter periods, many users experience less bleeding, less pain, some may even stop having periods. It's low maintenance, by the way, no need to always remember pills or injections. Reversible, once removed, fertility usually returns quickly, very quickly. Side effects, yeah, now being real, there are side effects to consider, okay? Irregular bleeding, especially in the first month, spotting, unexpected bleeding, cramping, mild cramping may happen after insertion. Hormonal effects, some people may experience mood changes, just like the other one, the Depo-Provera. Mood changes, headaches, acne. The rare risks, though uncommon: device movement, infection shortly after insertion. Oh, there is also infection, but it's a rare risk. So who is it good for? It's good for a hormonal IUD, maybe. Yeah, it's good for people who want long-term birth control, those who want a set it and forget it method, people with heavy or painful periods. So it's also important to note that hormonal IUDs do not protect against infections like HIV. So additional protection may still be needed. There are also myths, that it does not travel around the body, it does not cause permanent infertility, and it's not only for people who have had children. Uh-huh. So, and you see that hormonal IUDs may look small, but they work in powerful ways inside the body, creating multiple layers of protection against pregnancy. They're highly effective, long lasting, and convenient, but like any other option, they should be chosen based on personal needs and proper medical advice. Okay, proper medical advice, guys. Would you prefer something long term or short term, guys, when it comes to this? Because if it's long term, this IUD is the best choice. Short term, we've seen Depo-Provera is the best choice. So what do you prefer? What do you prefer? What do you prefer? And what concerns do people have about IUDs or any other persons? Some most people have. What concerns do most people have about IUDs? Any myths? Any myths about IUDs? Hey there, hey there. Let us know. Let us know. So how many videos am I expecting you guys to watch today? Okay, we've looked at how many videos. Let me see. So many. So many, so many. Let me see. First one, we looked at syphilis, of which that is a video on its own. Yeah, syphilis was a video on its own. What syphilis does to the body. Make sure you watch that video we've just reviewed. We've looked at it. Watch that video to have a clear picture of the causes, what it is, precautions and stuff, treatment and everything. Okay, fibroids, guys. If you want to learn more, make sure you watch that video. We've talked about fibroids. That is two, and you know we have two videos, I guess, about fibroids. So basically, looking at fibroids video, that is two videos in one review. That is three. What else have we looked? Type 1 and type 2 diabetes. Those are two videos. Explained in one. Those are five videos now. What else? After diabetes, we looked at gonorrhea. That was the 6th video. Gonorrhea, guys. And we've explained it in detail. We've looked at the myths. We've looked at the treatments, how it spreads, symptoms, all that, both in men and women. So make sure you watch that video. Okay, which other video have we? Those are 6. How to eat healthy food. Yeah, we also have that video and we've reviewed it. How to eat healthy food, guys. Make sure you watch that video. Those are 7 videos, guys. Make sure you watch them. I'll be waiting to see your comments, kindly. What else? What else? Yeah, those are 7. Yeah, we've looked at more than 7 videos. And the last one we've looked at... no, not even the last one. Those are 7. The complete acne treatments. The complete acne treatment guide. Those becomes eight videos. Uh-huh. How effective is the birth control? Depo-Provera 9. Guys, we've looked at 10 videos. Okay, those are 9. Depo-Provera makes it 9. And then the last one we've looked at hormonal IUDs. That makes it 10. 10, guys. We've reviewed 10 videos today. 10. 10. I'm expecting you guys to check up those videos. Give me your comments on those videos. Okay, they're so educative. I'm sure you learned something from them, just as you've learned something today. Okay, even if you've not engaged that much. Yes, guys, you can also ask a question or something. And also, I told you guys you should what is it called, you should also be recommending topics to discuss whenever we come on live stream. Okay, yeah, you can just leave a comment in our videos, or you can say it in the community posts. I'll get the message. Okay. Any questions? Any questions? Any. Mm-hmm. Hey there, who's here? Who's here with me? guys? Where are you? Where are you? People have come around. Hey there, who has joined us? Who has joined us, guys? Sijui kama ni wenye wamekuwa hapa ama ni wengine. Like nasema watu wenye wamejoin, sijui kama ni wenye wamekuwa hapa ama ni wengine. Wameenda. Hey there, who is still here? We are done with the video reviews of today. Okay. Any question, any concern, you can type on those videos. Make sure you watch. And if there is, can I say concern or something, anything to add on, or any concern, you can just comment on those specific videos that we've discussed today. Okay. Yes, guys. So thank you so much for watching, guys. See you in the next live stream. See you next time.